modules I'm going to address to our patients, something that you should know about if you're going to have a scan for cardiac tumor. In all modalities, CT, MR, PET, doesn't matter, we'll always need an intravenous access. And we'll always have to use contrast because how contrast behave in that tumor tells us so much. This is something that we cannot avoid unless there is contraindications for contrast. And for the patient, you need to prepare it for the MRI scan. It's going to be a long scan. I would say that you should not be afraid to interrupt the scan to get a rest period if you just couldn't tolerate it. The reason for that is simply because it is a much slower progress, and it takes time to get through all the characterizations that's important for your staging. So I think in the very beginning, you kind of set up discussions with technologists to tell them how much you can tolerate, and then you need to tell them that you need a rest, a break. They'll take you off the gantry, perhaps not off the table or move too much, but at least you can come out and take a small breather before you go back in for the continuous session. And then finally, after the CT and MRI, you might need additional imaging tests. So as much as we can do with the CT and MRI, it sometimes may not be definitive. And then require additional tests such as PETs, we mentioned, or biopsy to finally get to the bottom of the cell type for the tumor.